Under normal circumstances, our immune system keeps the body in check, but for reasons we don't fully understand, it sometimes goes awry. The result is autoimmune diseases, including Crohn's disease, which impacts the digestive tract. Here's the latest in this week's Positively Healthy. One of a group of inflammatory bowel diseases, Crohn's disease, impacts an estimated 700,000 Americans. Compared to other IBDs, it has a large strike zone.
And it can really affect anywhere from the mouth all the way down to the anus. But the most common spot is the junction of the large and small intestine.
It's a debilitating condition marked by chronic inflammation, uncomfortable at a minimum. The progressive condition may cause intestinal abscesses similar to canker sores in the bowels.
And those canker sores can cause a variety of symptoms, including pain, changes in the bowel movements such as diarrhea, intestinal bleeding, and they can even lead to blockages of the intestine by causing scar tissue.
Dr. Michael Cohen is a gastroenterologist with Physicians Regional Medical Group, working to better understand the disease. Are you seeing a higher rate of people getting them, or more people getting Crohn's disease?
There is a higher incidence of Crohn's disease. That's been noted in terms of demographics of the illness. There is an increasing rate of Crohn's disease.
Any indications why?
There's a lot of theories, but nobody really knows for sure.
Crohn's is an autoimmune disease. It appears bacteria may trigger a bad response in certain people, causing the body to turn on itself.
We have many, many bacteria in our intestinal tract as a normal part of our bacterial flora, and they are mostly harmless to our system. However, the body's immune system may sort of develop the sense that these are enemies, even though they're really not, and they may trigger sort of a exaggerated dysfunctional immune response.
Still searching for a cure, doctors have now developed better methods to manage Crohn's disease.
And over the last 20 years or so, there's been a huge revolution in the treatment of Crohn's disease. We've actually isolated some of the chemicals in that inflammatory cascade, and we're able to target certain chemicals along that pathway and stop the inflammation at that point.
Using a variety of biologics and immunomodulators, many patients now achieve a reprieve, appearing virtually disease-free.
Where they have no symptoms, where their endoscopy reverts back to normal, and their blood markers and stool tests may revert back to normal. And that's really, at the moment, the holy grail.
Improving quality of life, modern therapies for Crohn's disease is making a lifelong condition livable.